Over the weekend, Governor Asa Hutchinson authorized National Guard soldiers to help during the coronavirus crisis.
Soldiers are fielding calls, answering questions about COVID-19 from Arkansans and medical professionals. Stephanie Sharp went to the Department of Health today to catch up with those soldiers.
Here at the Department of Health, behind these doors, about 20 Arkansas National Guard soldiers are taking calls from Arkansans with questions about the coronavirus. These soldiers are easing the workload for the Department of Health right now.
She had the signs and symptoms. I don't know the results of the test.
Arkansas National Guard soldiers standing outside of a conference room that's turned into a makeshift call center. It's ground zero for the public's questions regarding coronavirus.
We'll have doctors and nurses calling in saying, what should we do with this patient, or can we have test results?
Private First Class Mallory Hollis is an Army medic. She has been in the call center since Saturday.
We get a lot of calls of where should I go, what should I do, what signs and symptoms should I be looking for.
In her day job, she works as an EMT in Dallas County. Her experience there helping her at the Department of Health.
I help people physically, civilian side, and then this side, it's kind of like, I'm just going to try to put their minds at ease.
The National Guard says before Saturday, the Department of Health had a backlog of 800 calls regarding COVID-19. Since the Guard stepped in, they are down to about 10 calls.
Easing the public's minds and just answering any questions they have about their signs and symptoms.
Private First Class Christine Hutchinson is a combat medic. When she's not in uniform, she works as a patient care tech at UAMS.
I know more about what the doctors are saying whenever they call, and then the nurses when they call.
These are two of a handful of Arkansas soldiers helping out other Arkansans.
She's at a very high risk
through this pandemic. They will be here to at least Friday. It could be extended longer if needed. They'll reassess that on Thursday. Reporting from the Department of Health, I'm Stephanie Sharp.